Well, today was a little bit of a bummer. I'll tell you what happened. One of my patients who traveled in from Mississippi arrived optimistic to get his hair transplant done. We deemed him a good candidate, remotely, and we were going to do some crown work. We were going to do some work at the hairline, and we knew that he had high blood pressure. So, I made sure to get medical clearance because he's a younger guy in his late 20s. His doctor cleared him for surgery and said, oh yeah, his blood pressure is well controlled on these medications. Everything is great. We booked a surgery. He arrived today. We started with pre-op vital signs, and it turned out that his blood pressure was hovering around 180 over 110, which is an extremely high blood pressure. And according to the American Heart Association, if you exceed either the systolic of 180 or diastolic of 110, you really should not do elective surgeries. We're not even talking about cosmetic surgery, but like any kind of elective surgery. So this is elective cosmetic surgery. No one actually needs this stuff, right? They just kind of want it to feel good, to look good. So anyway, we did a few different measurements. We used a few different machines, a few different blood pressure cuffs, and it just kept clocking in around, 170s to 180s over like hundreds to the 110s. And yes, he was probably a bit nervous and anxious for surgery, but regardless, those were the numbers. And we cannot compromise someone's safety just to do a cosmetic procedure, because what good would it be for him if he had a surgery and God forbid had some sort of cardiac event while he was here? Because when we do surgery, there's trauma involved, right? It's controlled trauma. That's essentially what surgery is. And even if he takes some Ambien and Valium, that might soothe the nerves temporarily, but all the epinephrine that we're using to control the bleeding, that can again stress the heart. I think it was the right call to cancel the surgery, and it was not an easy decision. I talked to him, to his mom. They were obviously upset. I told him, look, I know you saw your primary care doctor and that's great, but you really need to see a cardiologist. He needs to get his health in order first and foremost, and then come back for the hair surgery. So it was the right thing to do, but for practical reasons, my whole staff was just like, what do we do now? So for practical reasons and just for convenience purposes, it was not great for anyone involved. But sometimes you just have to do the right thing. You always have to do the right thing, but sometimes the right thing is not the easy decision, and you're not going to make everyone happy all the time. And it's something that, I've had to learn along the way. But at the end of the day, I have to make sure that my patients are first and foremost safe with the work that we do. And this was the call we had to make today. So anyway, it's just sometimes how the cookie crumbles, but I look forward to seeing him back when the time is right.